let's get right into Part A and B. So Parts A and B together make up what we make up original Medicare, and that's just because when Medicare first came out, what's included is that was it. So Part A is known as hospital insurance, and it covers inpatient hospital, skilled nursing, home health care, and hospice care. Okay, Part B, it's medical insurance. So it provides coverage for your doctor's visits, for labs and x rays, outpatient services, and durable medical equipment. I do want to point out something that surprises people many times. Part B does have a monthly premium. Fabian, how much is the premium for 2024?
$174. But keep talking about it because there's a little bit more information I want to get into. Give me 30 seconds or about a minute.
Okay. All right. So yes, for 2024, the monthly premium is $174. Most of the time, this money is taken out of your Social Security check. If you have trouble, however, paying this premium, there are ways around it. And again, you that's why it's important to speak with a knowledgeable broker who can assist you. So yeah, don't deny yourself of proper medical coverage because you can't afford to pay it. There is a way around
Definitely. Again, we've seen many people, just make terrible decisions because they feel that they don't qualify for certain things. And a lot of times you don't have to be fearful. There are ways to anonymously ask, the information that you're looking for.
it.
So,
Please.
part A first, if you work more than those 40, quarters, you will be entitled to pay part A without a premium. So that's you've been working for at least 10 years, and that's 40 quarters. You don't have to pay a premium for part A, you
Right.
or your spouse. So again, if you're married, if you're, let's say you're an immigrant and you have a spouse who's, not an immigrant and they're a U.S. citizen and they've worked more than 10 years, you qualify based on your spouse. Also, as Audrey talked about, people with end-stage renal disease and people who have ALS, they also qualify for a premium-free Part A. Now, for those who don't qualify for the premium-free Part A, your monthly payment will be $505 for those who have worked less than 30 quarters, and $278 for those who have worked 30 to 39 quarters. And again, these numbers are coming straight from the AHIP website. So if there's any disagreement, we're pulling them straight from AHIP, which is the standard body when it comes to training for Medicare. And also for the premium, we're looking at $174 for Part B monthly. So that's if your individual tax return is less than 100,000 a year in retirement, you would pay $174.70. And then, of course, if you earned more than 100,000, that's when you would fall into what they call the IRMA part of Part B, and so your premium would not be the $174. If you're a really high earner, you'll see a premium of $500. That's at the max level, $594 actually. And if you're, in between, so it's between 174 to 594. But most people are gonna, qualify for the $174, and most people that comes out of their Social Security check. So that's pretty much how that works. We'll go on to the next slide, Audrey. Or
Right.
is there anything else you want to touch
One
on?
last thing. If you delay your enrollment into Medicare, you will be charged a penalty. So there is what we call your initial enrollment period, also known as IEP. That is 3 months before your birthday, the year you turn 65, and 3 months after your birthday, the year you turn 65. That is when you enroll into Medicare. If you do not enroll into Medicare during that specific period, and if you don't have a valid reason, then you will be charged a penalty. So that premium for Part B will increase the further you delay your enrollment into Medicare.
Yep. So don't the early bird gets the worm. Don't be the person who
Right.
comes in late, and then you got to pay an arm and a leg to qualify.